This is service delivery for transition, age and youth, and adult empowerment versus care. My name is Lauren Fry, and I am on the side of empowerment.
My name is Goethe Laurent, and I'm as well on the side of empowerment.
My name is Shelby Smith, and I'm going to be arguing for the side of care.
And my name is Samantha Molesky, and I will also be arguing on the side of care. So the way that we've structured our debate is we've broken down our topic into different subtopics that we'll go through. We kind of connected them, and then each side will conclude, and we will then touch on questions that are pertinent to our debate, and then put our references up. So we will start with comorbid disorders and go from there. Autism spectrum disorders is often accompanied by comorbid disorders that may require treatments of their own. In the graph that you'll see, we'll see some of the most common disorders such as ADHD, anxiety, and depression, as well as some other less common disorders that still occur, such as bipolar disorder, obsessive-compulsive disorder, and oppositional defiant disorder. An individual with ASD may also suffer from comorbid physical impairments that affect their ability to be independent. According to Matson and Bailey, 2011, assessment of an individual with ASD should also include any physical motor deficits, as these may factor into any transition decisions that will be beneficial for the client. If a person with ASD suffers from physical impairment that prohibits them from dressing themselves or walking without assistance, a more care-oriented approach versus a more empowerment-oriented approach would be better for the client. They would have access to supports that would help them with hygiene efforts and just general life skills that they are incapable of performing independently, and then this will then lead them to a more happy and healthy lifestyle.
So according to an article by Stansel and Vogel in 2015, nearly 40% of those with ASD suffer from clinical levels of anxiety. It's a pretty high number. Those with autism spectrum disorders that suffer from high-level anxiety exhibit symptoms that, according to this article, they're associated with more behavioral problems and a higher level of life interference. Those with high levels of anxiety might find it pretty difficult to handle the pressure that comes from making decisions regarding their transition to adulthood. This is why it is important that there are people and programs in place that will help guide these individuals towards the decisions that are best for them to be making. If they succumb to the pressure that exists due to their anxiety, they might rush to make a decision, or they could end up making uninformed decisions that could negatively impact their future, which is why it's so important to have these care programs in place for them, as opposed to a more independent style of transitioning.
As these individuals get older and they are presented with many life changes, we can see anxiety increase. This is typical with anyone who may be experiencing the overwhelming feelings of new situations. Adults with ASD are no different. Because they already have deficits in communication and socialization skills, being presented with new people in a new environment can create unpredictability, which can heighten their anxiety. Results from a study, Sheck, Zamra, Teddy, and First, 2015, showed that not only the youth's concern for transition to adult caused anxiety and fear about finding a job. Another individual claimed they feared getting a job because they were afraid they would get fired and that they couldn't work in the evenings because that's when their medication would wear off. These scenarios give an example of how individuals with ASD are feeling and how important empowering them can help relieve some anxiety.
Having any type of disability is already a tough thing to deal with. Therefore, a comorbid condition renders life even more challenging. One of the tenets of quality of life is the possession of social skills. For students with ASD, a psychiatric comorbidity will greatly affect the social skills. According to Enshell et al., the greatest impediment for individuals with comorbid ASD and anxiety is the lack of theory of mind. Theory of mind connotes recognizing that we all have our thoughts and that sometimes they are different from the thoughts of other individuals. And Cherry will continue And they devoted a full session of the training to teach children with comorbid condition to acquire awareness of their own emotions. The expected result of this training was to help them to be able to make personal decisions.
Now we're going to talk about social skills. It is known that individuals with ASD struggle with social skills. A way to empower these individuals with ASD is using peer models. According to Jack Zamra 2015, challenges with individuals with ASD face is their need for mentors to model appropriate behaviors, time management techniques, roommate etiquette, and social connectedness. Along with this, many parents are overwhelmed with teaching their children social skills and how effective a social skills mentor would be in the workplace, as it could provide a model prompt for the individual with ASD.
Effective implementation of treatment to individuals diagnosed with comorbid conditions represent a challenge in regard to social skills, especially those who suffer with anxiety or any neurological disorder. According once again to Enchel, Polishek, McMahon 2011, psychiatric comorbidity affects social skill gains in the ASD population. The ideal training for individuals with comorbid conditions should focus on cognitive training in the hope of lessening anxiety. There is empirical evidence supporting the effectiveness of cognitive therapy in order to reduce the level of anxiety in young individuals with ASD. However, Enchel et al. Suggests that the emphasis on the attainment of social skills lack in all these studies.
So, on the other hand, in discussing comorbid disorders that we previously discussed, we're going to show a graph about anxiety with relation to autism spectrum disorders. In the graph, we see a 32 to 52% comorbidity rate of anxiety in individuals with autism spectrum disorders. So it's apparent when discussing the presence of social skills, especially in terms of successfully holding a job in adulthood, that the traits of anxiety can potentially come into play. It's super important when discussing the components of care to consider whether or not an individual has the social skills to hold a job independently, or to even have simple conversations with other people that they're going to come into contact with, such as doctors, pharmacists, store employees, etc. The list goes on. An individual with autism spectrum disorders that is lower functioning will probably not possess the social skills that are required to complete everyday tasks, let alone transition into adulthood and be able to hold a steady job independently.
When considering all of this, a study by Wilkins and Maps in 2008 determined that those with autism spectrum disorders displayed the greatest deficits in positive social behaviors and negative nonverbal social behaviors compared to individuals with ID who did not possess a diagnosis of autism. Knowing this, it would then be best to lead the family towards a program where the family member with ASD could be provided an aid to accompany them on errands and any social outings, as this will help assure the family that the individual will be safe, while also helping the individual navigate those social situations that possibly due to their anxiety would be very overwhelming for them to navigate independently. We will now transition to self-sufficiency, and while we do this, you should consider the importance of whether they're able to have those social skills as well as if they have any comorbid disorders. So depending on the types of programs that are available for individuals with ASD, they may not come out of their school program equipped with the social skills that will allow them to maintain a job or be independent in the community. This leads the family to need to look for options that will assure that the family member will be cared for properly, and this could range from assistance with hygiene and completing tasks to someone to just help them look over their finances or accompany them on errands and social outings to make sure that they complete their errands in a timely fashion and arrive to those functions on time.
So the individual might also have the option of being placed in a program that teaches them these skills while not leaving them totally on their own or completely independent. However, it would be pretty hard for an individual with ASD who's not self-sufficient to be able to find a job because there's a pretty high possibility that employers might not feel so comfortable leaving this individual without constant supervision. This is just another reason that exploring care options is so important. It's also important that the care strategies employed are adapted to the needs of the individual in order to ensure that they're able to succeed to the best of their own ability. Self-sufficient in an ideal world is something we would like everyone to be able to achieve, but in a lot of cases with individuals on the spectrum, something more on the side of care might be necessary rather than complete self-sufficiency.
In order for individuals to be empowered to be self-sufficient, they would need the necessary tools to make them successful. McDonough and Ravel 2010 discussed how individuals with ASD are empowered through different agencies offered by states to achieve employment goals. They discussed vocational rehabilitation agencies that specifically provide services for assessing guidance, training, and job placement services. Another was rehabilitation programs, who are non-for-profit, that assist individuals with disabilities in obtaining and keeping competitive employment. Local, community, and state boards also help find and provide services, opportunities, and employment for individuals with developmental disabilities. Another source was one-stop career centers that were available to anyone who needed help locating employment. These tools can help individuals with ASD feel empowered by learning and preparing for their job.
Being gainfully employed, being able to do things that we would like to do, of course, create self-sufficiency, even to those individuals with disabilities. But the sad reality is that not all can attain such goal. Care should be taken in helping those who have the potential to achieve this goal. For example, Clegg, Murphy, Almack, in 2007, referred to this failure as anomaly and hope that we will be able to recognize it one day. For valid reasons or not, they blame this failure on neoliberal stance of the idea of treating everyone the same. This view is based on the fear of being accused of exclusion, thereby lessening equality of outcome.
So here are two, this is the first graph, or this is the first visual to show unemployment rates through the years for individuals with disabilities. And as you can see, in a 15-year span, there has not been much of a change in this. The next graph shows employment rates for individuals with disabilities. And as you can see, ASD is the lowest. Only 20.9% of individuals have a job between the ages of 21 and 25. And all the other disabilities actually have higher employment rates. Now moving on to quality of life. Quality of life is another important component when empowering an individual with ASD. Jack Zamra, Teddy and First, 2015, mentioned that the attainment of quality of life is complex for individuals with disabilities, considering it is a concept that represents some challenges, even to some neurotypical individuals. One caregiver mentioned that her son had been fired for behavior-related issues and no longer was motivated to get a job, while another individual viewed getting a job as the most important thing on his mind. These examples show how a job can give these individuals a quality of life.
Quality of life. The role of a behavior analyst is to help individuals with disability to be self-sufficient, to feel good about themselves and achieve quality of life. But not all of them can achieve it, as I've said earlier. For example, an article by Shellac, Verdugo, Gomez, and Reinders 2016 discussed the steps for moving toward a theory of individual quality of life and the effect of personal characteristics and environmental factors. The article highlighted the importance of supporting those with disabilities, which will ultimately empower them. There are several strategies that may enable individuals with disabilities to retain quality of life. Help them to get involved personally. Avoid using one-size-fits-all strategies by individualized support. The strategy that may be the most precious of all is allowing them personal growth opportunities.
So, looking at things on the other side, quality of life is a subjective term overall. It might mean something different to everyone, depending on who you ask. They might talk about having a fulfilling job or being independent. Um, According to an article by Lynn in 1996, there's not one singular definition for quality of life, and it's honestly closely related to those who are around you. So this needs to be kept in mind when one is helping someone with transitional care. So the standard for quality of life will not be equivalent for every individual, especially for every individual with autism. The focus might need to be shifted to what's going on to ensure the most successful future for the individual. And that focus is not always independence, and sometimes it might require more care just to ensure that they have the best life they can live.
And if the individual is lower functioning and unable to be independent, it would be best for the family to set up care for that individual for when the family is no longer able to provide the care that the individual needs. This is a topic that families may not want to discuss or feel like they don't need to discuss, but depending on the level of functionality of the individual, it is a conversation that needs to be had and something that needs to be considered. The care program that the family chooses can range from assistance with every step of the individual's day to just having someone check in on them, or someone who only accompanies them when they're going to run errands or go to outings. And there is always the option of changing the program or fading out any of the programs that the family chooses if the individual shows sign of improvement from when the transitional care was decided upon. It's important that the family knows that this doesn't need to be a forever decision, and the individual may be able to show improvement and they may be able to fade out some of those heavy care-oriented programs. Considering everything that we've talked about, we're now going to talk about the ethics that are involved when it comes to making these transitional decisions. So when speaking in regards to ethics, there are codes that the behavior analysts must follow, and they're all compiled in the Professional and Ethical Compliance Code for Behavior Analysts. One of the relevant codes to this topic is Code 1.04A specifically, and it's that behavior analysts are truthful and honest and arrange the environment to promote truthful and honest behavior in others. This is especially important when talking about the transition of individuals with autism, because we need to be honest about what the clients are capable of and truthful about the treatments and supports that the client may need, regardless of if it's exactly what the family wants to hear.
Another relevant ethical code that pertains to the care of transition age young adults on the spectrum is 4.03A, which relates to the individualization of plans made. Individualization is something that's come up thus far in the debate several times, and it's an important component of the care aspect, as treatment would need to center around the care of that particular individual, what they're capable of, where their functionality lies. And it's, as we said earlier, not really a one-size-fits-all kind of deal.
Ethics. What is ethics? There are several definitions to the word ethics. It is not an error of judgment to mention that the decisions that are being made in Washington that affect the health of all, especially in an environment where every time there is a debate about budget, the area mentions mostly aiming to cut are health and education. For instance, Heron March Mangolis 1996 said the following: our personal, moral, and religious views are independent from ethics. If they were, we will be subjected to the ramification, which could be legal or sanctions. Those in charge of helping individuals with disability have an obligation to keep all consultation confidential. The absence of confidentiality may hinder the possibility to having access discussions, for example, about what individual with comorbid conditions need. The Ethical Compliance Code 3.02 focuses on medical consultation. It exhorts behavior analysts seeking a medical consultation if there is any reasonable possibility that a referred behavior is influenced by medical or biological variables. There is reason to believe this compliance was inserted in the code based on the empirical example that have shown various schools making, for example, the administration of medicine a condition for receiving academic programming. In conclusion, the role of a behavior analyst is not limited to the empowerment of the behavior of his or her client. It encompasses of social skill training, which will ultimately make it possible to become empowered. However, it is imperative for behavior analysts to be pragmatic, thereby understanding that a big segment of individuals with disability will be dependent for the duration of their lives. It is not an exaggeration to assert that quality of life, self-sufficiency, and empowerment are far out of reach for a lot of individuals with comorbid ASD and anxiety.
So with regard to care as well as empowerment, in conclusion, we think it's pretty safe to say that a compromise between the two can be made. As discussed throughout, individualization is of the utmost importance when it comes to providing services to those individuals with autism spectrum disorders. And because it is a spectrum disorder and all individuals are different, have different capabilities, it's really only fair that the treatments and services provided are different as well. And that's why it would be most appropriate to individualize a plan of transition to adulthood with an appropriate amount of care or independence or a combination of the two for that specific individual. So with that being said, that concludes our debate on care versus empowerment and transition age adults. So we have a few questions to answer that are pertinent to our debate. And the first one is, to what extent does empowerment overlap with care? Can care, for example, guiding and protecting clients in decision-making processes, facilitate empowerment?
There is an overlap in empowerment and care when it comes to ethics. Specifically, the client has a right to effective treatment. As treatment is very individualized, as we have mentioned throughout this whole presentation, for people with ASD, care might be suggested over empowerment and vice versa.
While doing our research on care, we can say that care can definitely facilitate empowerment, as adequate transition programs can provide an individual with the skills to become more and more independent over time. At the time of transition, the individual may not be equipped with the decision-making skills necessary to make decisions independently or complete tasks independently. However, this does not mean that it's too late for the individual to acquire those skills. Providing some individuals with assistance in the steps that they take during this transition time can further empower them to make those decisions for themselves in the future.
The debate about healthcare has been going on for a long time in this society. Obviously, everybody from all facets of life have been affected by, but more so individuals with disabilities. There have been many cases where districts have to be sued in order to provide health. Because of this climate, it created disparities. The disparities and inequities that exist in the healthcare system have created an overlap with empowerment. If an individual with disability is unable to receive quality care, the facilitation of empowerment may be a major challenge. When one feels good and confident about self, he or she feels empowered.
The second question is, how might you explain the distinction to parents beginning to plan for their child's transition age years, 18 to 22? How might you present and discuss this with direct care staff or staff working with the students' transition age youth in school?
Having a child transitioning to adulthood that has a disability is a very stressful period for parents. So it's what I'll tell them. There are several individuals who are capable of performing their job duties with efficiency and lack cognitive abilities to budget their money. As such, being an empowered individual will be challenging. In order to be empowered, one has to have the sense of what it entails in regard to empowerment. I would advise any direct care staff working with a student who is transitioning that having the capacity to care for self is commensurate with empowerment. And I will add that absent of empowerment, the quality of life and self-efficiency will be below standard.
So, when it's time to talk to parents about transition options for their child or their family member, it's so important to remind them of how many options they have. Focusing on empowerment is most beneficial when the individual ready to transition is high functioning and possesses the social skills we talked about earlier that are necessary to complete everyday tasks and potentially hold a job. This is when we would encourage the family to find transition programs that help them find jobs and further support their ability to do things for themselves. We would also encourage the family to remind the individual of all that they're capable of and support the individual's decisions to further foster that feeling of empowerment. On the other hand, it would be best to talk to the family about care options when the individual might be lower functioning and would lack the skills necessary to hold a job or live independently. It's important to stress that care does not in any way insinuate that their family member would be confined to an institution or be denied access to learning and improving on the skills that they have, because care can mean as much or as little guidance and help as that particular individual would need. When talking to direct care staff about the distinction, it's best to make sure that they're aware of the needs of the individual because it can be easy to assume that they're incapable of doing anything without assistance. These staff should be informed about the tasks that they need to provide assistance with and the tasks that they just need to monitor. If staff members provide too much assistance when it's not needed, they risk the individual losing mastered skill sets, and this would be detrimental to the individual. With all that being said, that answers our final question and concludes our Q&A portion of the debate as well as our presentation. So we'll put up our references that we used for our research. Thank you guys so much for watching. And we look forward to hearing any comments or questions you might have.
Thanks.
Cool.